Spondylolisthesis at L405. Grade 1 spondylolisthesis L405. That's the focus of today's Ask Dr. Walter episode 18. What I do in this video series, each and every day, I'll take a question from the comments in the comment section below my videos, and I'll answer that question in a video format and upload on my channel. The show is called Ask Dr. Walter Salubro, and you'll see a playlist at the end of this where you can catch all the other episodes. Here's today's question, and today's question comes from Carmen SM8. That's the YouTube handle, and this is what Carmen SM8 says. Do you have also a video with recommending exercises for degenerative spondylolisthesis, L405, grade 1, and what exercises are not recommended in this diagnosis? Best wishes. Thank you, Carmen SM8, for that question. It's a great question because I do see spondylolisthesis show up often in my office. So let's define, first of all, what spondylolisthesis is. It's a very long and complex word when you look at it, if you see it on your X-ray report or on your MRI report. But if we break down the actual two parts of this word, spondylo and listhesis, it'll make more sense what it means, okay? So spondylo refers to vertebra. Listhesis refers to slippage. So spondylolisthesis is a medical term for slippage of the vertebra. And this is a true slippage, not like slipped disc, which is a misnomer. This is a true, actual slippage of the vertebra, okay? And the vertebra can actually slip forward, which is called an anterior listhesis, or it can slip backwards, which is called a retrolisthesis. It can also slip sideways, which is called a lateral listhesis. In this question, I'm most likely sure that the question is referring to an anterior listhesis, because whenever spondylolisthesis is featured on its own or a question on its own, it usually refers to an anterior listhesis, okay? So this is what it looks like here on a model. So I put my models together, okay? And so the spine should be continuous, okay? Just like that. Okay, so if you see this on an X-ray, the spine blocks, okay, the vertebra should be continuous. In an anterior listhesis, watch right here, okay, right there. The actual vertebra slips forward. You see that? Here's a degenerative vertebra. So slips forward like that. In the back, you see it also slipped forward, okay? So that's what a spondylolisthesis looks like when it's an anterior listhesis, okay? And we can grade them in different ways. There's grade 1 anterior listhesis or spondylolisthesis. There's grade 2, grade 3, and grade 4. So grade 1 and grade 2 will typically be treated conservatively without surgery. If it's really unstable, then perhaps a surgical consultation may be needed. But if it's grade 3 or grade 4, it's a direct referral to an orthopedic or a spinal surgeon and may require actual surgical stabilization, okay? So basically what it means by grade 1, grade 2 is, and grade 3. So again, normal, it lines up, slips forward by a quarter distance from here to here. A quarter distance is grade 1. Half is grade 2, 3/4 grade 3, and then full slippage right there would be grade 4. As you can see, that's very serious, okay? So in this case, we're talking about a grade 1 spondylolisthesis or anterior listhesis, and that would be occurring at L4, L5, okay? So I know I'm getting very detailed with this because I want it to be visual as well as explanatory, so you can put them together, and then you'll understand what exercise would be useful and which ones should be avoided, which we'll talk about in a moment. And I am going to do a video in the near future actually demonstrating exercises that can be done for spondylolisthesis, anterior listhesis, and that should be avoided for a spondylolisthesis or anterior listhesis, okay? So here's a full spine model of the low back. You can see, again, everything should be lined up. So here's L4. If it slips forward, right there, you see that? I'll put it sideways, right there. See that slippage forward? And then from the back, you see over here, right there, is slipping forward. That would be an anterior listhesis, L4 on L5, okay? Symptoms that can be associated with that could be back pain, disc injuries, so any symptoms associated with disc pain, inflammation of the disc, shearing effect and injury in the disc. If the nerves are being compromised and stretched, then it can be not just local back pain, but also radiating pain into the legs and also numbness and tingling into the leg. There are corrective care techniques that we do in chiropractic biophysics to aim to correct and stabilize that. I'm not going to talk about that in this video. Maybe I'll talk about it in the future video. But right now, let's talk about what exercises can be done with an L4, L5 spondylolisthesis. So keep in mind the vertebra slipped forward. It could be possibly unstable. How do you determine if it's unstable? You do flexion x-rays and extension x-rays. Okay, and now what it does is it stresses the vertebra and the vertebral motion, and we can see if there's more slippage in the flexed position compared to slippage in the extended position, and then compared to the neutral position. Okay, so when there's an anterior listhesis, we want to do exercises that does not aggravate or accentuate or make this worse. Okay, so you can do exercises such as a posterior pelvic tilt, a seated posterior pelvic tilt. You'll see in some of my videos I talk about seated pelvic tilts. There's an anterior forward component and a posterior backward component. So you want to do the posterior backward component only because what that does is, so if you're sitting like this, you're doing the posterior component, it will help to stabilize that L4 spondylolisthesis. If you're doing the anterior one, you're going to actually push that more forward. Okay, so I recommend my patients to do a posterior pelvic tilt. Okay, it can be done seated, and it can also be done supine flat on your back. Okay, so seated or supine flat on your back, posterior pelvic tilt. So those are two exercises. You can also do dead bug for abdominal strengthening and back strengthening. So you're on your back, dead bug position, and you can do the cross arm and leg motion of the dead bug, and also can do planks like prone plank safely to help stabilize the back and the core abdominal muscles. So those are some exercises that would be warranted for a spondylolisthesis that's anterior listhesis at L4-L5, and also of course at L5-S1. Some things to avoid. So I would want to avoid the anterior pelvic tilt. Okay, so if you're tilting anterior, you're going to accentuate the lumbar lordosis and cause this to slip forward more. Okay, so avoid anterior pelvic tilt and avoid any lumbar extension type exercise like prone extension or full arm extension, and avoid things like Superman, which also extends the lumbar spine. Okay, so either things that are neutral with the back like planks, dead bug, or anything that will help promote a posterior movement to stabilize that lumbar area. Okay, so those are some examples that can be done with a spondylolisthesis, anterior listhesis at L4-L5, and some examples of exercise that should be avoided for a spondylolisthesis, anterior listhesis at L4-L5. Okay, so that's the answer for today's question by Carmen SM8. Thanks for submitting your question. And again, your question could be the next one featured in the Ask Dr. Walter Slubro video series, where I take a question from the comments and then I'll answer in a video format just like this, and it gives me a chance to connect with you a bit more personally. And as well, just because one person asked the question, it doesn't mean that no one else had that same question. Possibly another 10, 12, 15 people may have had that same question but just never typed it into the comments. So I know it provides content on my YouTube channel and can give you more information on a more regular basis. If you've missed some of the past episodes, do go right there. You see that playlist right there? And you can click on the playlist. You can watch them all from 1 to today, and you can also pick and choose the ones that you want to watch as well.